Hello, my name is Morgan Westbury, and this is my final presentation on my 300-hour internship. I did my internship at Post-Acute Medical Rehabilitation Hospital in downtown Corpus Christi. So, my internship site was Post-Acute Medical Rehabilitation Hospital. They proudly serve over 70 communities across the states for more than 20 years. Their mission at PAM Health is committed to providing high-quality patient care and outstanding customer service, completed with loyal, dedicated, and highly trained staff to be the most trusted and impactful source for healthcare in every community it serves. This hospital offers services for patients with brain, heart, and lung functions and disorders, chronic conditions, orthopedic conditions, and other complex medical conditions. They also supply with infections and a wound care site. My objectives for my internship were developing hands-on skills in the clinic. During my internship, I was aiming to begin practice OT-related tasks like observing treatments, evaluations, and documentation strategies, as well as tasks with the patients during the treatment sessions and building professional relationships with them. Another one is improving my communication and professionalism. I wanted to improve my potential communication with patients, their families, and other healthcare team members in a way that shows I am trustworthy, reliable, and respectful. My third one is to receive feedback from my site supervisor and colleagues that will encourage me to become the OT that I've dreamed of becoming. Next is my fourth one, which is exploring the different specialties that are given. During this internship, I hoped to gain more information about specific specialties like outpatient and inpatient clinic that I'm currently at and how it differs from pediatrics and mental health clinics. My last objective was to gain more behind the scenes experience in the day-to-day responsibilities of an OT. I hoped to learn their responsibilities that include scheduling patients, building specialized treatment sessions, billing strategies, and the ways that insurance plays a role in the amount of care the patients are obligated to in outpatient and inpatient setting. My best experience during my internship, I actually have two. One was being able to connect and build a relationship with every patient that I got to meet and work with. I learned how active listening and showing empathy can motivate patients during treatment sessions to engage more fully. This experience has helped me grow professionally and personally in how to actively listen and be able to create different ways to direct their attention to the activities at hand. My second experience was being able to watch progress happen in real time with each patient. A patient in particular had significant limitations after working with them and implementing strategies that gradually improved their ability to perform daily activities. Watching them regain certain independence and confidence in activities were very rewarding. My most challenging experience My most challenging experience was one that was emotionally challenging rather than physically demanding. When a patient that I had been working with for several weeks started showing signs of rapid regression and required us to send them home from the clinic, which we call a clinician canceled session, it is very difficult to see the patient's hard work and progress being impacted by an unexpected medical reason and complication. We weren't sure what was going on and had to refer them to get imaging and tests done before they were able to return. This experience taught me a valuable lesson about how unpredictable this nature of the setting is and of the setting of rehabilitation. It also highlighted the importance of emotional resilience, therapy teamwork, and having to maintain professionalism while supporting the patient in their personal needs during these difficult situations. I have four things that I would do differently if I was to start over again at this internship. During my internship, my first one is to take more initiative. During my internship, I often would just follow what my supervisor had planned for each session and just getting the equipment ready as well as helping the patient start it. If I could do something differently, it would be to see if I could come up with my own personal treatment sessions, of course, under her supervision, and this would help me build my confidence and creativity with making these. My second one is to seek more feedback. I would make more of an effort to seek more feedback from my supervisor and document the reflections. Although the evaluations at the 150-hour and the 300-hour have really helped me with feedback, I wish that I was more open to asking for more. This would help me identify strengths and areas for growth that are periodically rather than the 150 and 300 mark. My third one is aiding in documentation. Documentation is a very important role in this type of setting. If I could do it differently, I would ask to see if I could try to write documentation myself. Obviously, not submitting it because I'm not a healthcare professional, and just having my supervisor check and see if I had done it correctly, or even making a case study and I would document as an assignment for it. My fourth one would be to engage more. Although I did engage a lot with the different patients that we had and with all of our other healthcare therapists and assistants and techs and all the things that we had in our clinic already, throughout my time, I have seen how valuable having like family is and making sure that you have family support in the patient's recovery process. I wish I would have been more involved for offering different techniques and exercises and adaptive equipment to implement at home other than just giving handouts. So speaking to families more often about the different take-home exercises that we have and as well as informing them more of the adapting equipment that is available for them. My most important professional lesson while at my internship was that I was learning and understanding the importance of real patient-centered holistic care. Every patient's recovery can look completely different, and then also what might work for one might not work for the other. I have learned to listen carefully to the opinions and thoughts of our varying patients and adapting interventions and meeting our patients where they are physically, emotionally, and mentally. This has taught me empathy, flexibility, and creativity are just as important as clinical skills as you're learning in school.